some organization bring in meditations experts and to teach people how to do meditations and to do relaxation as well. It could be about, educating people that they need to take a walk every now and then, go for a breather outside, to relax themselves, take away from their not sitting at the desk 8 hours a day kind of thing.
Welcome, Australia. It's that time again for another podcast from the Mate team, where we try and get into your head with stuff that makes us sound smart. Sit back and relax. It's time for us to be mates.
In today's episode, we're talking with Dr Frank Chow, a workplace-related mental health specialist. Dr Chow is Director and Psychiatrist at leading Sydney-based practice 2OP Health, a unique organisational and occupational psychiatric service specialising in workplace-related mental health care, providing tailored solutions to individuals, organisations and health professionals across Australia. At Mate, we understand the strain that the workplace can put on an employee's mental health, as well as the way the workplace has evolved over the last year due to COVID-19. Through our hashtag Let's Be Mates movement, which supports the Black Dog Institute, we want to help raise awareness of mental health issues, especially in the workplace, and help where we can. We chat with Dr Chow about workplace burnout, how to support employees' mental health, as well as uncover some strategies to help you switch off outside office hours, especially for those people still working from home. Welcome to the Let's Be Mates podcast, Dr Chow.
Thanks, Mark. Thanks for having me.
Awesome.
Yeah, we really appreciate your time today. Maybe for our listeners, Dr Chow, if you could give yourself a bit of an introduction and tell us what you do and what your specialties are, and anything else you might want to tell the listeners.
Sure. So I'm a psychiatrist in Sydney, and over the years I've become more passionate about helping people who have mental health issues in the workplace. And so I'm the directors of 2OP Health, which is a psychiatric psychological clinics in Sydney, and we are the go-to mental health care provider with tailored occupational psychiatry and psychology services to individual, organisation and health professional across Australia. We run quite a holistic methodology to focus on prevention by identify early interventions, education, rehabilitation, structure mental health treatment plans, and we provide both psychiatric treatment and psychological treatment for individuals, mostly who have issues in the workplace.
And so how did this journey to the business that you're in now and what you're doing now, so how did you personally, how did this journey come about? How did you get into this world and why?
That is a very interesting question. I started off with my medical degree wanting to become a cardiologist and surgeon, right? And I don't know.
Did you end up doing that though? Did you end up doing that?
No. I didn't.
Okay.
I didn't. And I think I have always been intrigued by people and why certain people cope better versus certain people, and want to understand, what make people clicks and what make people becoming more high functioning, for example. Yeah. So I think eventually I come across psychiatry, which is a specialist in the medicine where we learn about people more, and that's where it all started. There's also a great need for it, and it's very interesting. And that's how I jump into it. Now, over the years, I've done all sorts of subspecialties and treating people with anxiety, depression, drug and alcohol. And at one stage, I was subspecializing in elderly as well.
Okay.
And then for quite a number of years now, I got really interested in people who have issues in their working career, for example. And I've seen the recurrent patterns of it. And by giving them the help they need early on and giving them the guidance quickly, you can make a lot of difference to people who are in working career and help them to, manage things better and to avoid the complication of, divorces and occupational reputation issues and all of that. So I've become much more passionate about, helping people who are in the workplace. And so that's probably where the journeys has come through. And there's a big focus now on helping people to get better in the workplace as well. I mean, when I first started, it wasn't that prominent and that much of a focus.
Yeah.
But in the last couple of years, it's just the tune has changed. The attitude has kind of changed as well. There's a lot of biases or misunderstanding or things like that from both sides, both employee and employer. And over the years, I think that relationship is bridging the gap and is starting to improve, I think. Yeah.
Yeah, and we've obviously Mate's been going for a while, but I mean we've been involved in different businesses and managed different people in different places. And one of the biggest things I've learned in the workplace is that people all learn differently, right? People all consume things differently and do things differently. And I've seen a lot of people get new employees, things like get stressed about learning something new or doing something different when systems change or when new services come on board and stuff like that. And what we've realized at Mate is that we need to make sure that we are aware of how people learn and how people consume information, because we're all trying to do the same thing, but some people learn or understand that in a different way. And we actually saw in our business, like because we grew so fast and we're always putting new systems in place and new solutions in place, it actually caused a lot of anxiety with staff, because the challenges that came with growth of a business, where they had to learn pretty quickly, they have to learn new systems. Somebody learns it quickly, somebody learns it slowly, somebody does this part, somebody does that part, and that's something that we found that can quite easily happen in the workplace in 2 seconds without you even noticing if you're not taking notice of it. Have you found that in your experiences when working with workplaces like that?
Yeah, so I've come across many different type of workplace, because people come to me from all sorts of organizations, publics, private organizations, slow growing industry and fast paced growing industry as well. I think I can sum it up in probably a couple of words or sentence, where problems occur when the expectation and the perceptions are misaligned and there's a lack of communication. Yep. So employees have their own sets of, expectation and perceptions of the situation they're going in, while the employer have a certain expectation, but also a certain perception of the individual. Yep. When the expectation and the perception doesn't match, and they are not able to communicate. Sometimes it can be communicated despite the best effort, but sometimes it's the communication issues itself that's not communicated through properly. So, the lack of communication and the poor communication and the lack of insight of the situation are the key of all sorts of problems that create anxiety, confusion, depressive state, frustrations, acting out behavior in the workplace, and resentment towards each other, for example. So I think that will be my summary of my observation over the years about all different kind of organizations. Certainly with a fast-paced business like yours, people need to keep up. People need to make sure they're able to keep up the pace and their dynamics. They're agile. They're changing. They have that expectation of the organization, but also themselves. And as a boss, you would have the expectations to people as well, and the culture, how do you create from it? And is there an encouraging, environment for people to seek out how to, address the anxiety, to look for ways to improve the situation? That's the key. If you have anxiety, that's because you are not so sure about how you're performing. And if you're able to direct them to improve and help them to pave a path to help them to address that situation, to address the source of anxiety, then they will improve. The guidance, are there the support there to help them? And sometimes, when you're going through a big challenge in your business, maybe, people don't know the answers and they don't have the path to go there. And it's about the leadership, where the leader are able to carry them through uncertainty time and leading them through, that uncertainty, work through them with that uncertainty, even though you don't have an answer.
Yeah. So I guess when there's that misalignment in between the employer and the employee, and if your environment's not conducive to people speaking up or people being afraid to say, I'm struggling or I'm anxious about something or I'm burnt out, like what are some of the signs as an employer that we can look for in our staff to go, look, maybe that person is not dealing well, are struggling a little bit, maybe they need some extra help, extra time. Like what sort of signs should we be looking for as an employer? Yeah.
So often it can be the workers are starting to, we're talking about employer perspective here at the moment, and we can shift to employer perspective later on. But from an employer, you often see from a range of presentations, it could be from as small as they're not as talkative, they're more avoidant to direct interactions. You can see that they're turning up to work a bit more, more not as punctual. They're making more mistakes at work and error. They're not, sending work in on time. To the middle level where they're becoming more irritable to others, and sometimes they too extreme. One is they don't talk at all. They've gone quiet, unusually quiet, or they become unusually sarcastic or making a lot of jokes that is not appropriate, and they start to have attendance issues, significant performance issues, to when people are starting to act out, yelling, screaming, bullying others in order to cope, or overly dependent on others. And you can see that they are actually not making decisions themselves and overtly depend on others as well, because they lost their confidence. So it could range from, mild, moderate, and severe, but also whether they're internalizing their distress or externalizing their distress. So those are the common things, a lot of the time irritability depends on customers or, staff, managers, and whether they get complaints from customers, staff as well. So those are the things that I observe. And I hear people talk about for my, patients as well as the employer that complains about,
Well, we always say it, mate, a great culture is a mental health booster, right? Great culture allows you to be allow you to say what you feel, be able to tell somebody what you're feeling, to be able to be open about the challenge that you're having, whether it be performance, whether it be at home. Like people spend 90% or 80 or 90% of the time at work, right? It's like you need to be as comfortable as you are at work as you are in your personal life in some ways as well, to make sure that helps you, right? It's so important.
So yeah, absolutely.
Yeah.
So sticking with the employer perspective for a moment, the last year or so has been a added challenge on top of all the other workplace mental health issues. Is there remote or potentially a hybrid workforce where people are working in their homes, or they're coming to the office a couple of days a week, or maybe a week in a month? What are some of the strategies that you would say to employers around managing this remote issue now, as well as is it different to when staff are in the office, or is there other things that we should be looking out for, or strategies we should be putting in place for everyone when they're not working face to face?
Yeah. So there's an explanation why people feel anxious and depressed, and certainly uncertainty time make people more anxious. When they're very confused and depressed due to the misalignment of their priority in life, Like previously, if you live in Sydney, it's all about work, and pay your mortgage, right? So suddenly the pandemic come, is like, what's the point of paying your mortgage if you can't enjoy the rest of it?
Absolutely.
So then you become very confused, and why do you keep going to work? So I think when you become confused, you lack the motivation, you become much more depressed. And it's about working out what's your priority in life now. Like, is it about working a bit less and to see your family a bit more and work through that? So the other some of the things that people find very anxious is, traveling in the public transport. I mean, not so much, last month or so, but, for a couple of months, people keep asking me, is it safe to go on public transport? How do I cope with exposing to others? If there's a potential outbreak, here and there, and lockdown, what to do? People continually being very anxious about an uncertain time. And with the vaccine now, we're a little bit more, feeling a little bit more safe. But I think there's still a lot of uncertainty and questions being answered. So as how do we help workers as an employer? A lot of people, maybe we can come to three groups. Yeah. Some people knows really well they have problems, and they take active measure to address it. That's fine. Those are individuals who have good self-awareness. They have good insight about their problems and their communicating style, their strategy in terms of managing their own distress as well. The second category are individuals who may be starting to recognize their distress, but they don't know how to manage it. They don't know what are the strategies available. So they keep going. They're using their unhelpful or maladaptive strategy to continue to cope. Like, they might continue to work a lot. If they're workaholics, if they like to smoke or drink alcohol, they might be smoking more or drinking more alcohol. Or they might be projecting their anxiety onto their family or spouse in the workplace. They might appear to be more irritable and projecting their anxiety to other people. So those individuals is about helping them, directing them to learn the strategy, to acknowledge what are the things to help them relieve the anxiety more so. And I assume, like, your organization would have some processes to install to help people learn about how to manage their distress, anxiety. Some organizations bring in meditations experts and to teach people how to do meditations and to do relaxation as well. It could be about educating people that they need to take a walk every now and then, go for a breather outside, and to relax themselves, take away from their not sitting at the desk 8 hours a day kind of thing. The third category is the most concerning one, is they don't have the insight and they are not aware that they are not coping, but people can see they're not coping, but they can't see that. Those individuals will have a tough time for the employer to have a conversation with, but it's very important to have that conversation, and learning how to stage the conversation, but also to get them to understand that people are concerned about them, something is not quite right about them, and to direct them into maybe talking to certain individual that can help them. That could be, talking to their managers, mentor, or peers, families and friends. They can access, depends on how big the company is, but majority of medium-sized company would have an employee assistance program to at least start that process to talk about things. Or even, encourage them to go to their GP and have a chat, and learn what are some of the, signs and symptoms when people are, quite distressed, for example. So that's to start the educational process first before they take the step to start to, address and learn the strategy and address it. Because at the end of the day, if things are left too long, we will see those mild and moderate behavior in work, but then we might see the very extreme behavior before we can intervene.
Yeah. You mentioned a question before. You said to us, "Hey, in our organisation, we have processes in place to support mental health and stuff like that." But that wasn't always the case, right? So there's always an action that happens to a business to make them stand up and take notice. It's something they need to focus on, right? In your experience, right? When businesses need to probably have a bit more of a proactive approach, instead of if you start a business and you start with a couple of people, then you grow and you grow. One thing you forget about is the well-being of people. You just keep growing and you keep doing and you keep going, right? And then, in your experience, have you come across businesses that just haven't put the right focus on it, or are businesses just not thinking about it still? For us, it took a situation for us to really put that level of activity in place to make sure that we monitor our staff and how they're going and how they're feeling. And I don't know, I'm just thinking about our listeners and who own businesses. What point should they start thinking about this? Pretty much straight away, right? Would you say?
Yeah, I think I'll just give you a little bit of history, I guess. But I think back then, even just a couple of years ago, I think the understanding of mental health in the workplace from an employer perspective has been a bit limited, and especially knowing the impact of employee mental health to their business. And as we are more aware about the impact on productivities, absenteeism, as well as workers' comp claims as well, and the impact of the economy, the productivity to the workforce as a whole, we have been increasingly realized how big of an impact it has been and could be over the years and in the coming years as well. The two extreme that workplace practice that should I guess we should mention is, in the past there have been workplaces that kind of not sure what to do with it because it's such a difficult problem. So we just wait for a crisis to occur before we make changes.
Yeah, exactly. And sadly, it's maybe human nature for us to do that. But yeah, I hear.
Exactly. So because it's just to to install a mental health program, processes, it's a lot of work. It's a lot of cost.
Yeah.
Right. Why would you want to go to do that if you don't know the consequences?
Yeah. And
if you're not sure the consequences is that big. On the other hand, there have been companies that once they realize the consequences, they want to install it, but then they've gone overboard. Right now, any support need to come with some kind of limitation and boundary. If you just provide support, unconditionally, then it's just going to take up all your resources and it's just resolving people's whole day. And that's what happened. Once people, organizations that has adopt some strategy, for example, it just open up a can of worms because they don't know how to manage it. They don't know how to set up the boundary, what's appropriate, what's not appropriate. And therefore it just become, people start complaining all sorts of things in the workplace, and it's become out of hand. So they go back to the original state where just ignore everything. So it's about understanding what is the appropriate level of engagement and support and culture, and set the expectations and also offer the right support to the employee. You can't be an open door to, as a manager, to manage the person's psychosocial life, right?
Yeah.
The manager need to learn what is appropriate, what is, beyond his league to offer the support for the worker. You cannot be a social worker and a psychologist in the workplace to your worker. What is your role as a manager, and to what length you can offer your support to the person, that need to be defined. And if you don't, then you you burn your managers out, and you have a bunch of workers say, well, you want to help, but you're not giving me the help, right? So that just get out of hand.
Yeah.
It's tricky. It's a fine line, I guess, between, giving the right amount of help and then not, diving in too far past your remit. Like, we've talked a lot about the employer and the workplace side of things, but as an employee, especially now where a lot of people have been working from home and still continue to work from home, what are some of the strategies that you recommend for people to sort of switch off and step out of work mode when they're not necessarily going to an office and coming back home? And the work-life balance, if we want to call it that, was already blurred enough, and now we've got a working from home situation. What are some of those strategies you recommend?
Yeah. I mean, I think work from home is not a very common practice before 2020. And I wouldn't call myself an expert in terms of advising how to manage working from home before that. I mean, I guess I myself is spending a lot of time working from home as well. But some of the strategy I think we hear and people are talking, and I do agree as well, is you need to have a good demarcation of the work at home, in terms of the setting. And where you work, where there's a desk, where there's a space in the workplace that you dedicated, this is for work, and your leisure, whether you're going to spend your time eating with your family, playing with kids, or watch TV, try to do all those activities in two different places. If you have a bedroom turned into a workplace, then use that bedroom or use that workroom as your workstations only, and don't go in there to watch movies or do other non-work kind of leisure stuff. Important to step away from the workstations regularly, so you can go to the kitchens, have just like you going to your kitchen at work to have a cup of tea, change the appropriate clothing when you're in the workstations. When you finish work, change back into your pajamas. Try not to wear pajamas in front of the computers if you can. Step out from the house, step out from your apartment. Every now and then go for a walk. Interact with your neighbors and people and family outside of the home setting, because that has been blurred with being a work setting as well. I think those are quite some of the suggestions I will have from an environmental, but also practice perspective. But I think that's something I've learned as well. The gadget with the iPad and the iPhone, for example, is probably a good idea, and I find it very useful. I don't know others, but I found that it's very important I switch off all the notification, and I only check email and messages, work-related messages, when I'm in front of the computer. Because otherwise, when you're sitting in the lounge, you start checking iPad and your iPhone for work messages. You're in bed, you start checking all the messages as well. Then you're working 24 hours a week, and you stay at home 24 hours a week, then you're just working 24 hours a week. Yeah. So have a dedicated time, what hours you're working, and what gadgets are you using. Use some of your iPhone and iPad as a leisure. If you have different iPhone, iPad, nowadays a lot of people have that, then that's a great idea. Otherwise, turn off your notification in your iPhone and your iPad if it's work related. And just check that in the, or have a work phone, have a work phone instead, or a work iPad instead.
During COVID, I myself personally, I dug myself a deep hole in regard to technology, right? So working from home and then taking your phone with you to make a cup of coffee, you're reading your emails as you walk to get your coffee, or you're checking your Slack or whatever it is, and then you might have a lunch break, but you're taking your phone with you, and you've got you're watching an updated video, or you're looking at whatever it is. It's all like you're taking your phone with you and you're working along because you're thinking, okay, well I'm not I'll have lunch, but I'll continue doing this, etc. And you don't even realize you're doing it until all you're doing is literally using your phone and going through your email. You're constantly working from 8 until like whoever knows what time it is until you literally go to bed, because you don't even, but subconsciously you don't even know you're doing it, right? And that's something that I realized for myself. Yeah,
I think there's also a perspective that was definitely pre-COVID, and I think it's been carried through, that there's an expectation that I'm working from home, I need to prove that I'm being busy, I'm online, I'm connected, respond quickly. And I think as an employer, we need to be able to trust that an employee is getting their work done, and that if they're offline for 20 minutes, maybe they're going for a walk and clearing their head so they're going to be more productive when they get back. There's not an instant access to them 24/7, and especially even just during business hours, I think.
Yeah, I mean, I think different industry have a different needs to
absolutely
monitor their workers' performance and output. I think a couple of months ago on TV, they were talking about having some kind of gadget and cameras to monitor the workers sitting in front of their desk. I'm not quite sure how that will go down very well with employee. But I think certainly having the right expectations of KPIs and of the day-to-day KPIs or work output is very important. And as we as the economy moving into more more cognitive demanding, creative kind of businesses. And we are not able to monitor people all the time. And if you do that, you do micromanagement style of management, then the creativity will not be there. So I think certainly having the ability to allow people some flexibility to manage their own thing, but having the right metrics to measure the performance is the key. I mean, going back to what Mark say, I'm certain Mark was able to monitor how he was doing it and how he's impacting on his own mental health. But the certain individual, when they're not aware what a anxiety feel like, and a certain feelings of a motivations, a mild burnout we talk about, for example, then sometimes they wait until they start to have some kind of physical symptoms like a heart palpitations or breathlessness, hyperventilation, panic attack episode before they realize they have worked too hard in this situation, circumstances, and they haven't been wind back and giving themselves the time to wind back throughout the week or throughout the days over the last three months period, for example. So that's very important to recognize. Some individuals just unfortunately have not developed that insight and awareness. And it's important for us to educate people those kind of feelings and what to watch out for and how to be aware of the early signs of burnout so that they don't lead to a more sinister kind of picture. Yeah.
So we spoke a lot about employees, right? Sorry, employers. So let's talk quickly about employees. And so when employees are feeling like they're burnt out, they're stressed, they're suffering from depression or whatever's going on, I think a lot of the challenges is they have anxiety of the possibility or thinking of going to say to the employer, this is how I'm feeling, this is what I'm doing. And I think that creates another whole level of anxiety, right? And so what's your advice to employees if they're feeling this way and they're in a workplace and it's affecting their work and they've noticed it themselves, but now they've got the anxiety, oh, geez, do I tell my employer because I don't know, what they're going to think I'm not good enough or are they going to get rid of me or so on and so forth. And, what are some of the tips and tricks do you think that, employees should think about or individuals should think about when they're in that situation?
Yeah. So, commonly I have observed workers are generally quite conscientious, right? They want to be perceived, they have a good output, and they are performing well at work, and they want, their managers to like them, obviously.
Yeah.
So, a lot of workers are not very good at complaining. But I think I'm not encouraging people to complain, obviously, but it's about how you communicate that through to others is the key. Imagine if you're conscientious and you don't want to burden your manager and workplace, and you only try to build up yourself, yes, and that's fine early on, but it becomes detrimental to how you're managing your life, your sleep, your eating, your health with family, and all you're just trying to manage is to please your workplace. Then eventually your resilience is just going to drop. Your ability to sustain is not going to be continue. It's not going to continue forever. So it's quite important that we don't wait until we have another crisis in life before we go to our bosses and say, my wife is divorcing me now because I spent too much time at work. I mean, you go to your boss with your personal life problems. Yes, your boss will be very empathetic about that, but then, you present them with your psychosocial problem, they're not going to be able to offer you a solution, right? So, I think it's important to go early and express your difficulty in a first person view. Before you reach out, don't let it become a emotional charge conversation, too emotional charge conversation, because otherwise it's going to lead to unfavorable support and response. You're going to trigger your managers to and it's difficult, I understand, but it's important for people to be aware, because sometimes they go to the boss and say, my life is falling apart and my life is a mess, and your manager will, as a manager, you'll go into shock mode.
Yeah, absolutely, 100%. I've been in that situation. I agree.
And then they're looking for you for a solution.
Yeah.
And as a manager, no matter how empathetic and how helpful you want to be, but you're not going to be able to offer a solution because you don't know what to do. So you might just, and the most common thing when you don't know what to do, what are you going to do? Like, you either ignore there's a problem, or you pretend there's no, or you say there's no problem there. So, because if that's the human nature. If you don't know how to resolve a problem, you become defensive, or you ignore there's a problem. You often say you'll be fine, you'll be okay, you'll get through it, but the person just come to get help from you, and then you're not offering the solution. So often they go back and say, I told my boss my problem, but they didn't offer me a solution. And so then they think that they cannot trust their manager anymore, and they often do the same thing. Like, they go to their friends, their family, they tell them their problems, but the friend and family doesn't know what to do. It's even more of a problem of a case when the person has been the most capable person in the past, and everyone look for them for a solution, and suddenly the most capable person go to the dependent person for a solution. Everyone's just going to go in a shock mode, right?
Yep.
So then they further shut themselves down to saying nobody's prepared to help me now. So I've seen that a lot, and I have to help them to understand the dynamics, how it all developed, and you need to reach out to the right person. That's why the manager need to guide them to the right person to speak to, and get them to the right place, right people. And by going there early, by talking in the first person view, I'm struggling, I'm not coping with this particular task. Are there ways to reduce or delegate the task, or modify it temporarily so I can cope better while I find a strategy, to improve how I cope? So talk about in a first person view, rather than providing go to your workplace with a psychosocial problem. I know it's difficult because when you're emotionally charged, all you can see is your problem, right? And you want someone to fix that problem.
Absolutely.
Yeah. And Obviously, if unfortunately, if your bosses doesn't know how to help you, often they're shocked. Then reach out to the medical support. Go to your GP. Have a chat there, and because the GP are trained to do that. Once again, I mentioned it earlier. If you portray, like if you tell your workplace colleagues to say, "Come to me with your problem," they will come to you with your problem.
Yeah, of course.
But if you don't know how to support them with the right way to redirect them to the right source, then all you're going to do is just going to shut down and ignore that there's a problem, and then people will resent, and then they will find you unsupportive, which is probably a misperception. It's just because the manager wasn't equipped with the tools to deal with the person who's coming open up about the difficulties.
Yeah. There's a lot of different situations, and you've given some really good strategies. But if people are looking for more sort of resources, where should they go to look for some more information?
Yeah, obviously, there's a lot of good website now, Black Dog Institutes and Beyond Blues and all that have good sources of information. I found, informations are well abundant online. It's about, which ones you find useful to your situation. Because when you're emotionally charged, you don't concentrate, you can't read, right? And you might not read the things that are applicable to you. So it's always better to have guidance and find, have people to guide you what to read and what to focusing on, for example. I mean, the best person, go to mentor, peer groups, or, people who might have experienced issues before, who might be able to give you the guidance. But if you don't have those kind of, network, then your own GP is a good start. The workplace have EAP. EAP is the employer assistance program. They obviously will, be a start for you to have a chat. Often it's a bit short-lived, but, it's a good start. And you can then go to your GP and start having a chat. I mean, you don't necessarily have to be referred to a psychologist straight away.
Yeah.
Just having a chat with a GP, for a couple of sessions might be able to give you some tools from the GP's perspective, and that can help you get through your burnout period or your period of distress at that time. If you need more guidance, then obviously refer to a psychologist or psychiatrist. And when you need medication or when you need more holistic kind of view of the whole picture, then a psychiatrist might need to be refer and consult as well.
So you've given us a lot of information today, Dr. Chow. I appreciate your insights, and your knowledge is second to none, and I'm sure people listening here are going to learn a lot, ask themselves a lot of questions about themselves, and people who own businesses are probably going to think differently about their workplace as well, which is really important. But look, if people want to work with someone like you, what's the best way to get in touch with you? How can they learn about your work, and how can they learn more about you? Where can they go?
Yeah, so the best way to start will be to visit the website of the tuophealth.com.au. So 2 is a number, and OP Health. And we have a psychologist, a great psychologist, psychiatrist, with a lot of experience in people who have struggled with the workplace, and the phone number is on the website 0298727209. If you want to make a booking to have a chat with one of us, but also just browse through the websites and some of the blogs and articles in there to start off with is fine also. So that's the best way to reach us and reach me to have a chat.
Oh, that's
don't be afraid to speak to a psychologist, psychiatrist. I think if you get a good sense that they are there to educate you and support you and help you, you don't necessarily have to take medication before you see a psychiatrist. You don't necessarily have to be suicidal before you see a psychiatrist, and you don't necessarily have to be very unwell or clinically unwell before you speak to a psychologist, because you can learn strategy from a psychologist to manage some of the simple stress releasing relaxation technique as well as a maintaining kind of strategy to help you keep going. Yeah.
Very important words, I think. Dr. Chow, we really appreciate having you on the Let's Be Mates podcast. It's been great. I think our audience is going to get a lot out of this. And what we might do in a couple of months' time, we'll get you back on just to see how maybe the world's changed a little bit and seeing what your views are around businesses and what they're doing now. But I mean, we really appreciate your time, and I think what you've offered us is invaluable. And so we thank you for being on.
Yeah, appreciate the podcast invite, and I really enjoy talking to you guys, and hopefully, people will find it useful. And thank you for having me today.
No worries. And look, we'll put all Dr. Chow's information on our podcast script and when it's posted, so where everybody can click and link and find out all about it. But thanks again. Really appreciate it.
Okay. All right. Thank you.
Thanks for listening to the Let's Be Mates podcast by the team at Mate.
Search for the Let's Be Mates podcast on iTunes, Spotify, YouTube, and at letsbemates.com.au. Hit subscribe to get the latest episode each week.
For all your telco needs, choose a provider you can trust like a mate. Visit letsbemates.com.au, Google Mate, or call us on 13 14 13 to sign up today.
See you soon, mate.